Hello, this is Dr. Steele. Today I want to talk to you about medications. Medications can be subdivided to what they do to the body and what the body does to the medication. Pharmacodynamics and pharmacokinetics. Dynamics, what the body does from the medication, what the medication does to the body, that's what that means. And pharmacokinetics is what the body does to the medication, how it's processed. But the main theme of this conversation today is to realize that as we get older, I mentioned in my previous videos, all of us our machine, our body starts having problems, challenges. The substances that we used to produce and the structures that we used to produce start to change. If not, look at your gray hair. That ink from those cells, melanocytes that produce that color, they tend to go away. That's where we get gray hair. So at the same time, that's what we take sometimes medications, especially in patients with diabetes. We start giving medications that have been proven to replace or to augment or to make things better, more the equilibrium of the body work better. So patients tell me all the time, Dr. Steele, is there a way for me to stop medications once I have diabetes? Doing diet and exercise? Well, for that answer is always yes, but that's not necessarily stop taking medications, because those medications have been proven to lower inflammation inside our vessels, inflammation. They have been proven to regulate better the metabolic this balance called diabetes. So we don't want to negate medication as long as that medication is well prescribed. Medications have not only prevented infections, prevented us from dying from infections, but they have come to balance our body, or the imbalance of our body, they have been able to improve that. And that means what? More time in this earth by controlling your blood pressure, your cholesterol, your sugar levels, and also supplementing your vitamin D, supplementing your testosterone, supplementing your thyroid, or any other imbalances that your body goes through as we get older. So it's important also to remember that most patients tell me, Dr. Steele, you're going to give me 5 pills? And they say, well, that's too many, Dr. Steele. Why 5? And that's a lot of medication. And I always tell them, okay, let's do an exercise. Give me all the pills, put them together, and you're going to see that it's insignificant to the amount of food that we all need to eat just to keep us alive. And sometimes we eat 2 twice or 3 times a day. So it's insignificant. And remember, I wish it was not true, but even the water, even the food that we take, all those have chemicals, all those are going to help us restore our cells. So we're just taking a little bit extra, but that little bit extra of medication adding to the good diet and exercise is going to make your metabolism or your imbalance or your cells work better. So it's true that medications have side effects, but we forget that they also have side benefits. And we talk about side effects, but we don't talk enough about side benefits. Most of the medications are going to help us live longer if they're well prescribed. And the side effects, I don't care if it's aspirin or anything, any medication that we prescribe, it's going to have a laundry list from A to Z of side effects. And the reason for that, you need to remember that we live in a very litigious society, that if we don't disclose the possibility of a side effect in that medication, then that could, create a case, a legal case. So it's important also to recognize that allopathic medicine, meaning medications that we prescribe that we have to prove that they work or they benefit our body, they're going to have that laundry list. But homeopathic medicine, natural supplements, they don't have to go through that rigorous information for the patient. So patients do not have a laundry list of side effects of vitamin C or vitamin B or any other product that is considered a natural product, like considered like a vitamin, like a supplement, but it doesn't mean they're not as dangerous And there has been cases that people have gotten very sick taking supplements, but they don't have to disclose that. So that's why we make a bigger deal of the prescribed medication than the natural or the supplement medication. So it's important also to realize that after many years of coming up with new medications, we are actually increasing our life expectancy because we have not only better food, better water, but we also have better medications. And I'm very excited because right now for diabetes, we have a lot of new options and a lot of new tools that are making our patients not only control their diabetes, but they're actually making people live longer with quality of life. So my talk for today is don't shy away from good medication. Don't be scared about things that could happen to you, because if you have hypertension uncontrolled, diabetes uncontrolled, cholesterol uncontrolled, that in itself is going to put you at risk from dying, right? Living less time in this earth. So always find somebody that can explain that to you and can give you the pros and cons and the alternatives of any treatment. But please understand that we live in a time that we actually have a lot of miracles. We just don't see them because we take them for granted sometimes. So take your medications, talk to your doctor if you have any questions about any of them. And again, thank you for watching. Talk to you soon.